Hey, Lisa. Can you hear-
Hey, I can hear you. Can you hear me?
I can't see you.
Yeah, I'm still coming on, I guess.
Well, I'm not sure. I've been having problems here getting my camera and my audio to work.
We had problems. County schools were, internet was totally down yesterday.
Oh, wow.
Yeah, and today somebody was telling me that it was down somewhere, but I don't remember where now.
Are we the only two so far?
So far.
Now, it was at 3, right?
No, it's at 3:15.
Okay,
They're just trying
gotcha.
to drive me crazy, starting a meeting at 2:15, at 3:15. They should either started at 3 or kept it at 3:30, but no, it's at 3:15.
Okay.
So everybody will show up at 3:30 except us.
Well, the thing that I got said 3, so that's why I was trying to.
Yeah, well, the invitation would not, for some reason, Zoom would not allow me to schedule it at 3:15. So I had to schedule it at 3. Because you know how that stuff is.
Oh, yeah.
Let's see, somebody else coming, must be Kevin. Maybe.
Okay, are you there?
I am.
Okay, I'm trying to
I
fix my camera. I don't know why it's not showing.
oh, I didn't know why mine is, but now I do because I haven't opened my laptop. That's why. You have to open the laptop, Lisa. There I am, but I don't think I can help you.
Well, um, I have a docking station that's got problems, so I'm trying to figure out another portal. I have to connect everything to my laptop. And I only have so many outlets. I don't even see an option.
Do you want to try to get out of it and come back in? Sometime, reboot.
Like reboot the entire PC or just reboot,
Well, it's just like go out of Zoom.
go out of Zoom. Yeah,
Sometimes that helps.
let me give it a shot.
Okay. Hey, Misty.
Hey, Lisa.
Hi. Rob was with us, but he couldn't get his camera to show, so he's trying to get that to fix.
Okay.
Ignore my email, Lisa.
Okay, I will.
There you go. Now can you hear me?
Yes. Hi, Ryan.
Oh, I was muted. Hi, Lisa. Hey, everyone.
Okay, we got you, Bob.
Okay, now can you hear me? There
Can
I
hear
am.
you and see you.
All right. Just keep clicking stuff till something works.
Right. Hey, Nita.
Hello, this is Sue.
Hi,
Hi.
Sue.
I am in as an attendee.
Well, you're
There we go.
being upgraded to a panelist.
Hello, sorry.
Hey, I was just going to let folks know Katie's running a little bit late. She's having to do this remotely. And then my internet is having some problems. So I'm on my hotspot on my phone and I'm hoping that this all works out. But if my video starts going a little wonky or something like that, or the voice does, then I may cut the video off to see if that fixes the problem. But hopefully I'll be okay.
Welcome to my world, Jennifer.
So are we waiting for a quorum? I mean, what do we need to have a quorum? How many more?
Albemarle needs 5, Charlottesville needs 4, so both of us need one more person. We need Martha.
I have to say, I believe
There she
Martha just
is.
came on and she fills both. So there we go.
Martha, you're a superhero today.
So we both have a quorum now.
All
And
right,
the health department, Erin is not coming.
okay. And so let's get started. This meeting is being held pursuant to and in compliance with ordinance number 20-A16, an ordinance to ensure the continuity of government during the COVID-19 disaster. The opportunities for the public to access and participate in the electronic meeting are posted on the Albemarle County website. Participation will include the opportunity to comment on those matters for which comments from the public will be received. And we've been doing a roll call. I think the easiest way is I'll just call on you, introduce yourselves and what agency you're representing. And so this is Nita Davis from Region 10, and I am the Albemarle CPMT Chair. Missy.
Good afternoon, everybody. I'm Misty Graves. I'm the Interim Director of Human Services. I am on the city CPMT side and the community attention seat.
Ryan.
Ryan Davidson from Albemarle County Office of Budget. I am on the county side.
Mary.
Mary Stebbins, Albemarle County Social Services. And just so you know, I need to leave sometime around 4. Just I have to hop onto the Board of Supervisors meeting. So just FYI, we will lose our quorum potentially. Right? So, but we should be done with voting by then.
Yeah, we'll try to be done with voting by then. Krista.
Hi, I'm Krista Gallio with Court Services, and I'm here as the representative from the Program Subcommittee.
Sue.
Hello, I'm Sue Moffett. I'm the director at Charlottesville Department of Social Services.
Martha.
Martha Carroll, Director of Court Service Unit, City and County member.
Great. Ashley.
Hello, everyone. My name is Ashley Reynolds Marshall, and I serve as the Deputy City Manager for Racial Equity, Diversity, and Inclusion for the City of Charlottesville.
Beth.
What are we doing?
We're just doing roll call. And so we have to say it out loud as an ordinance. And so just saying your name and agency.
Beth Baptist, Charlottesville City Schools as Director of Student Services and HR.
And our CSA coordinators, we have 2 guests and our CSA coordinator. So let's start with the guests. Kevin.
Kevin Wazalewski, Assistant Director, Albemarle Social Services.
And Bob.
Bob Roach, Senior Accountant, Charlottesville Social Services.
Jennifer.
Jennifer Wells, CSA Coordinator for Albemarle County.
And Katie's not here, right? Okay. Did I miss anyone? Okay. All right, let's get started. And so you have a consent agenda. Do I have a motion for the city to accept the consent agenda?
It's Ashley Marshall. I so move.
Thank you. Second.
Martha Carroll, and I second.
Okay, all those in favor of approving the consent agenda for Charlottesville, say aye. Or raise your hand.
Aye.
Anyone opposed? Okay, so passed. And do I have a motion to approve the consent agenda for Albemarle?
I move to approve the consent agenda.
And
Martha Carroll again, and I second.
All right. Anyone opposed? Verbally say aye. Okay, it's passed. So we welcome Bob and Kevin. We had talked about doing a quarterly review in a way that we share screen and just a little bit different. We'd asked Bob and Kevin to do their presentation. And so I'll turn it over. Who wants to go first? Kevin?
I guess we're alphabetically first, so don't buck tradition, I guess. Now here, let's see if I can share my screen. That'd be the good part. So let's see. All right, can everybody see my screen? I hope so. Looks like we can. So what I have for you here today, I went ahead. I know typically when we come, should have been January's financial report. But since we do have February's, okay, sorry, hold on, dummy. There we go. These are our February numbers, and I'm going to run off of this sheet more or less for most of what we're going to talk about today. So what you see here, we have our February FY22 services. So it was $821,000 for this month, and we're at $5.3 million for the year, which is up almost 11%, and about the same amount up in local funding as well. A little concerning, the cases are actually down slightly. The one thing to remember, although looking at the 5-year trend, the first thing I thought of last year was it took a long time for payments to get in. But if we were to look, so this will be the Q2 charts, which let's see, you should have had for December. So here's what the charts look like in a 5-year trend as of December. Next month, we'll have the Q3 charts, but we don't have that data in just because we're only 2 months through this quarter. So this is concerning. Costs are up. It's hard to rely on these encumbrances here. It looks like we have 92% encumbered as of right now, which could be alarming. But the issue with that is a lot of things do get encumbered and then are not taken off. Typically, we try to get staff members to, look through their list of open invoices or open encumbrances to see, okay, are we not going to provide this service? And there's a significant amount of reductions that come when we do that process. But considering the staffing levels and the workloads, it's just one of those things that falls to the wayside, and I get that. So sometimes these numbers aren't as good, but the projection here versus last year of us being up 11% with cases being down 1.2% is enough to draw attention, and let's keep an eye on it. And for the year, as you see here in the chart here, 49% of the costs are special education, 17% are foster care, and 34% are foster care prevention. So some of the foster care and all of the special education fall under over here what's called the neutral rate. So for the year so far, we've spent roughly 3.1 million at the neutral rate. Foster care prevention, the 34%, is at the lower match rate where we only pay 22%. We've spent 1.8 million. And the sliver in foster care that is at the higher rate, the congregate care residential placements, we're at $387,000 roughly. And if you take all those things together, our effective match rate through those three match rates, we are right at 37%. So your average cost per case so far is $22,531, and local only expenditures due to agency error, which mostly come from payments that somehow did not get paid for the prior year, or it can be something along the path that we didn't complete the correct steps along the path of the case. We've spent $12,000 in local only money. So, and the percentage rate, you can see expenditures at a lower match is at 35%. The neutral match is at 58%, and higher is 7% of our costs. And for so for the year so far, if you'll look here for Medicaid payments, so for all that you know, Medicaid payments, if Medicaid is willing to, or if a child is Medicaid eligible, they're submitted through that process. Medicaid will pay their share, and then the state will reduce our budget roughly. It's about at the lower match rate. So when we request money, reimbursement for costs, if there are Medicaid eligible cases, they'll reduce our revenue by this amount here, or I'm sorry, over here. This is the local share, 150,000. So we've had 619,319 claims so far through January. So it's a little behind, and those cases cost us 150,650. But that is a good thing, because if we were paying for these cases, the match rate is much higher. So it's a difficult accounting step to try to explain, but it is a good thing, even though it does reduce our revenue. If we were to pay that, it would be a lot more. So, and here again, like I said, the encumbrance numbers are alarming, but I just, we just need to keep an eye on these percentages. First thing I thought of was, well, everything came in late last year, so maybe this isn't that big a deal. But like I said, looking at the Q2 chart, we are quite high compared to the 4 years previous at this point in time. So something to definitely keep a watch out on, and we'll keep finance and budget apprised of this as well, Brian, of course. I think Tammy's sending this to you monthly. If she's not, let me not make sure. I'll make sure that she is. I think we did agree to do that, just so you guys can keep in the loop and know what's going on. So this is through February of this year. Remember, we pay through September. So just something to keep an eye on. It is up. And we'll just keep an eye on it so we don't get surprised monthly. And I get to come back next month too, so we'll get to look at it 2 months in a row and see where we're at. So does anybody have any questions or want me to go over any of the other sheets that were distributed to you? I mean, most of the data here at the high levels on this sheet, and the other sheets just kind of go into more detail. So if there's something anybody would like me to go into more detail about, I'm happy to do so.
That was awesome, Kevin. I appreciate the ability to follow along where your cursor is. That really helped a lot. I just had a couple questions, and I don't know if it's for you or for the broader CPMT, but other than the SPED, which I think you mentioned, what other things can be done to reduce the cost, or what are some of the other things that may be impacting the cost if the numbers of kids are going down?
I would have to do a little research. It could be that some of our costs, well, it's more services. It's got to be more services, because it's the rate's about the same as far as the increase. So that tells me that the nature of the services may have not changed very much, but the quantity of them, if that makes sense. So if I was to see, so right here, if we're looking up here and I see 10% increase here, and I come over to local costs and I see a 15% increase, that's telling me probably we're using more residential placements, or we're using more the neutral rate in foster care instead of foster care prevention. Or if I see vice versa, if I see, this 10% goes up and this is only 5%, well, that tells me we are increasing costs, but we're probably doing it at the lower rate. We're probably providing more prevention services than we are others. But right here, this is kind of, they're going up kind of the same way. So it's just, what it looks like is just the nature, there's just more services being provided kind of at the same rate as of last year, as far as breaking them down by foster care prevention, and special ed, if that makes sense.
Thank you.
Thanks. Any more questions for Kevin? All right.
All right, I will.
Thank you, Kevin.
Thank you. I will see you all next month too. Look forward to it.
Kevin.
I'll stick around. I'll stick around for Bob's presentation though, Bob. I want to hear yours too. So.
Well, Bob, are you ready for your presentation for the city?
I'm about as.
Just 1 second. Katie's in the attendees list. If I don't know how to move someone over.
All right, you can start, Bob.
All right, I'll try to keep up with Kevin. I'm learning as I go. Let me see if I can get this shared. Make sure I get the right one up here. See, this is February. Okay, I had originally planned to do December, but since Kevin did February, I'm gonna go ahead and do February too, because that kind of makes sense to give you a clearer picture of the update. One of the things that Kevin has done is showed an average cost per case, which we had not shown before, but Sue had asked me to add that, so I have. And the first thing that I noticed was that our average cost per case of 16.6 is about, I don't know, $600-700 more per case. So it's actually pretty close. The one thing that I did notice on ours that is different than Albemarle's is that our numbers kind of peaked in 2019 and have been going down a little bit. We've caught up quite a bit with some of our bills, although I'm sure there are still some, just like Albemarle, that have not been paid yet. I know that today when we did our check run and I was reviewing it, there was a lot from the Virginia Institute of Autism. There had been some staffing and other issues that had kind of bottlenecked those invoices. So we had a number of months coming from them. So I think that was in itself a pretty large chunk. It was 200 and something thousand by itself. So there are some costs that have not yet hit our reports, but I think in general, I mean, if that were included, we'd probably be pretty level with last year at this point. And you can see previously I had mentioned that we didn't have a lot of cost in the first quarter, and you can see we've caught up quite a bit there. In comparing this year to last year, our mandated amounts here, 479, the 4E payments, 58. We did get finally our Medicaid through December is in here. There's nothing for February yet. So I believe this is just through December here compared to last year. That number is up slightly. We have almost 7% there and just a little over 7% there, which I think kind of jives with what Kevin was saying. I think that if you look down here, our special ed is somewhat higher percentage over last year. I think last year there were a number of POs that had not been paid yet. We've caught up quite a bit, except for the VIA that you see there. So a big chunk of our costs are going to special education. Foster care prevention is about 14%. And then foster care about 39%. The non-mandated is pretty much statistically insignificant. You can see the higher match over here is very low. A lot of the majority of our costs seem to be here at the neutral. So we don't have a lot in these congregate care, et cetera. And then the lower match, I think if I'm going to look at last year. Oh, I had last year open. The lower match last year was exactly the same, 24%. As a matter of fact, it all looks pretty much the same as last year as far as the percentage of each level of match. I really like this. I think I'm clicking on the wrong one. I got my other monitor going here so I can see last year's. I really like this. It really gives us an idea. We're slightly up on our average cost, but our cases are down significantly, as would have been expected looking at the year-to-year costs, as I just showed you. Medicaid, this is just through December. We're slightly up on the Medicaid. I'm not sure why that is. If you look at the local share from year to year, it's really not that far off. And as I said, the almost 7% is pretty statistically close there. I'm trying to think of anything else Kevin might have mentioned that I haven't yet. As I said, our case numbers are down. I am not sure why that is. I don't have those numbers. In case anybody was wondering, I'm not sure why our case numbers are down in general. At one point, I thought it was because schools last year had not been in session, but I think I was corrected on that it wasn't necessarily coming because of the school. So I'm not sure why the case counts are down. With the cost per case slightly up, which makes sense. I think we're doing more of the special ed, which is probably higher cost kind of stuff. Any questions or points, Kevin, if there's anything you can help me point out here?
I think you covered it.
All right, any questions for Bob? Okay. Thank you, Bob and Kevin. We appreciate it.
Yeah. Well, goodbye, and we will see you next month.
Thank you so much.
Can somebody hit the stop share?
I'm trying. I'm not sure how to.
It's up. Sometimes it hides. If you move your cursor up, you might see it.
My whole I'm going to try and just exit out because my whole thing is kind of not giving me any options here. Oh, that didn't do anything. Oh, here it is. There we go. You're right. Did that do it?
No.
Stop share.
Right.
Did that work? All
Yep.
right, cool. See
Thank
you
you, Mom.
guys.
Bye.
Great. So now we are on the action items of our agenda. And we'll start with the provider agreement revision.
Yep, so this is for an out-of-state provider, and it's already gone through the county attorney. So we're just bringing it here to you guys to review and get your approval.
Would anyone like to make a motion to approve the provider agreement revision?
I move to approve the provider agreement revision.
Second,
Who seconded?
Brian.
Okay, thank you.
Okay. Anyone opposed? All right. All those in favor? I'm not sure how to do that. Can we say anyone opposed? And if no one's opposed, does that mean, Lisa?
Yes.
Okay, that makes it a little less awkward. All right, our second one is the emergency placement policy change.
Yeah, so you guys might remember we talked about the sort of situation that we find ourselves in where we need a placement on an emergency basis. And if the provider has a revision, we've always had the practice of bringing it to CPMT first. And so this was the language that we drafted to put in our local policy that would allow us to go ahead and proceed with that change, knowing that it will come to you guys as soon as you meet next for your approval.
Thanks, Jennifer. Is there a motion to approve the emergency placement policy?
I move that we approve the emergency placement policy.
Second. Sorry.
Were we doing county or city?
Oh, do we have to do?
You're right. It's both. Yeah.
Is question. So like when we did the provider agreement, oh, that was county only. I'm sorry. Okay. So let me try this one again. Emergency placement policy. Can we get a motion from the city? Beth is trying, but you're on mute.
Also move.
Thank you.
Misty seconds.
All right. Anyone opposed? The motion passes. Can we get a motion for the emergency placement policy from the county?
I move that we approve the emergency placement policy for Albemarle County.
Mary seconds.
Okay, anyone opposed? Seeing none, it has passed. The next one is the case conferencing policy change.
Yep, so for this one, we just kept it clean and just made it the 75, which just seems like the easiest way to proceed with that.
75 an hour, is that?
So it would be up to a maximum of 75. So if their hourly rate's less, we would honor their hourly rate, but otherwise that would be the maximum. And I feel confident that that's gonna work out fine.
That makes sense to me. Is there a motion from the city to pass the policy change for case conferencing?
So move.
Second.
Can we get a motion from the county? Oh, I'm sorry. I didn't finish it. Is there anyone opposed? It's been a long day. Seeing no opposition, that's passed. Can we get a motion for the case conferencing policy from county?
So moved.
Second.
Anyone opposed? Seeing none, that policy change has passed. Our last one is the Dcse referral policy change.
Yep, so for this one, you guys had agreed to temporarily suspend number 3 in our local policy, which has to do with parental placements. So that is where we're making this revision to the local policy. At some point between now and June, which is how long you guys extended it to, you'll have to make a decision about whether you want to pursue those Dcse referrals. So like we had said, our previous process is no longer one that we can use. So if you all decide that that's something you want to continue to do, we'll have to come up with a new process. I had talked to Mary about, we had pulled the report for the amounts that we had received, and it really is like 50 cents or $1. And so there's sort of a question about whether you all feel like it's worth pursuing those, or whether you just want to take that particular referral piece out of your local policy. But again, so for today, it's just making that change in our local policy that you guys have suspended it through June.
Thanks, Jennifer. Can I have a motion from the county?
I move to approve the changes to the parental contribution to cost of services.
Do you have a second?
Second.
Is there anyone opposed? Seeing none, that has passed. Is there a motion from the city for this policy change?
This is Ashley Marshall. I so move.
Second.
I'll second it, Sue.
All right. Is there anyone opposed? Seeing none, this referral policy has changed. Okay. So those are the formal action items. And we're now we move into the review of system function and activities. Do we have a FAPT update?
We do. So we were just going to let folks know, Katie and I are starting to work on our recruitment process for the private provider rep for FAPT, that their terms are going to be running out as of the end of June. So we are working on our calendar for how we're going to roll it out. We're going to do it the same way we did it previously, which would have been 3 years ago. And so it's actually the same time that our CPMT private provider rep for the county. The city doesn't have one currently. His term's going to be expiring as well. So we'll actually be trying to recruit for both of those. I think that's it for FAPT update.
Yeah, and so those recommendations will probably come to you all in June for voting. The way we did it last time is sent out a flyer to private providers. And there's an online application that they can fill out. It's pretty simple. And then the CSA coordinator and the FAP chair interview folks. And it's vetted through the FAP team and program, and then we'll come to you all. And I apologize for being late. I'm quarantining, so I can't go to the office. And there's 4 children at home that I know would not leave me alone if I was trying to do a meeting. So I'm in my car, which has broken AC. And so I apologize.
Thanks, Katie. That makes me laugh that you're in your car is your little office. Okay. And so the review of routine foster care expenses and FAPT approved expenses.
Yep, that's just for your information. If there's any questions from CPMT members about that, you're welcome to ask that here.
Seeing no questions, the CSA coordinator update.
Yep, so for this one, I just really quickly wanted to bring up 2 things. One is the county is moving in the direction of hybrid meetings. So we just learned that the Board of Supervisors and 2 others, I think, are moving towards that. I'm sure at some point this meeting will likely move in that direction as well. I don't know if any of you guys have a time frame for when that might be. No, okay. So I think part of it is just making you all aware that if we go in the direction of a hybrid meeting, part of the question would be whether your attendance would need to be in person at that point. And then if your agency allows you to be at an in-person meeting. So I think we just need to make folks aware so that you know that that's the direction the county's moving in, so that you're prepared for, again, we're not really clear how it's all going to work, but I know the Board of Supervisors in Lane Auditorium, they're set up, I guess, to conduct a hybrid meeting. I'm not unclear if the county has other spaces that would be able to accommodate that, but I know the Board of Supervisors meets the same time that we meet. So that would be a problem. I know we could not use that space for this meeting unless we change when we meet. But again, it's informational. Wanted to share that with you guys so that you're aware that that's the direction we're moving in. And I don't know if the city has any update for you guys.
Hi, everyone. It's Ashley. And I apologize, you all don't see my face. I got stuck at the dentist office, but I didn't want to miss the meeting and want to make quorum. So the city, in their last meeting, City Council signed an update to their continuity of governance document, which states that for any meeting to be brought back, even in a hybrid posture, a safety plan needs to be established for the specific room that meeting is going to be held in. And the safety plan is co-drafted between the city manager and the mayor. At this time, I am not aware of any safety plans that have been drafted as of yet. However, I would want to share that there are 2 rooms in the city that are outfitted to be able to do hybrid meetings without moving any equipment. So that is City Space and Council Chambers. So if needed, I would recommend we consider City Space. I think the posture is going to be to keep Council Chambers really for council at this point for cleaning schedules, because City Space has some offices in it. It is cleaned more often than having to add the council meeting to someone's rotation. They might accidentally miss it. So that's really where we are. So I know I just basically gave you a whole lot of, I don't know, but that's where we're at.
Okay, that makes sense. The only other thing I wanted to bring up quickly while Mary's still on here before she has to run is just making you guys aware of, I know I had previously brought up the situation about needing to maintain foster care youth without a placement. And so we are in that situation. We've been in it now for a couple of days. And just to make you all aware that when we go into that type of setting, that is an unapproved placement, and that is not a CSA eligible cost, which means that the cost for this placement becomes local only. So it's something that I wanted to bring up here, and Mary, whatever you wanted to share.
Yeah, we have talked to OCS, to Scott Reiner, and we've also talked, myself, Khaki, Alice, met with the state, regional folks, and one state folk yesterday about it. There is some funding available. We can use Chafee funds for this particular youth, but those funds are limited. Luckily, the state has more funds that we can ask for, so that we're going to pursue those funds to pay for his placement. But then we're talking, we have 2 staff with him 24 hours a day, except for when he's at school. So those are those costs, food costs. I don't think CSA pays for anything when they're in an unapproved placement, correct? Yeah.
The only thing that we were authorized to pay for were services. The only service he's getting is mentoring. And so we were allowed to pay for mentoring. We could not increase mentoring to make it look like we were using that as supervision.
Yeah, he's in an Airbnb right now, by the way. We rented a duplex, half a duplex with 3 bedrooms. So that's where he is. We do, knock on wood, think we have a placement on Monday, starting Monday. But when we started this, there was no thought that this was going to end anytime soon. We did not have, he was on the waiting list for this place, but we were planning for months of him sitting in this Airbnb with random people coming in and out taking care of him. So it's a problem. Yeah, and he started on Friday, I believe. Was it Friday? I think it was Friday. He's been there. So that's the update for now. But yeah, so the state is also in conversations with OCS about this problem as well. But that's where we are.
So like I said, it really is just to continue that conversation of what can we do as a community to try to address this. I don't, again, it may not happen that frequently, but when it happens, it's clearly a huge deal. And so there's obviously local only funds that we're talking about. So, it impacts a lot of folks. And I think it's just important for you guys to be aware that it is happening. And so like I said, I just don't want to lose the thread of that conversation that we've been having for a couple of months now. And I think that's pretty much it for the CSA coordinator update, unless folks have anything else that they wanted to add to that.
We talked about a couple things that we can do as a community, one being research, like reaching out to some of the local providers first to talk about their specific needs and what policies they have that end up being barriers, and just learning more about their policies and why those are. And then maybe that's a licensing barrier or something like that, but just getting some clarity through reaching out to some of the current providers or more local providers. Are there folks that would be willing to make a phone call or two? If there was like a questionnaire that was drafted?
Yeah, program's also been talking a lot about this the past couple meetings, and so I don't know if that's something that we would want to suggest to program. I know program at the last meeting had CAF come and talk about maybe what some barriers might be to having foster families who would take these kids even for a weekend or something like that. So we started a conversation around what supports the foster homes might need. that they're not already getting to feel okay with taking some of these kids, even if it's just a day or two or overnight or some, while DSS comes up with another plan or something like that. So I think if you guys have suggestions like that, that are kind of tasks program could work on, that would be helpful, because it's along the lines of the conversations that we've started to have in that group.
That sounds really smart and effective. So I guess, how do we make that a formal request to program to do some research on individual agencies' barriers and including policies that may be barriers and what they might need?
Yeah, I think we can have it reflected in the minutes. And Jennifer and I, and Krista, I'm not sure if Krista's on here or not, can certainly share that with program at the next meeting.
Yeah, I'm here. We'll do that definitely.
Okay, that sounds great. Are there any OCS communications that we need to go over?
There weren't any for this month.
Good. And Krista, do you have a update from program?
Just a couple of brief updates. In line with what Katie was talking about, we were brainstorming of ways to be more supportive in, when there isn't a placement available, or perhaps when we need to place someone on an emergency basis in a CAF home that may not be permanent. So we've each agreed on programs to either be a point of contact for our agency or to identify a point of contact for our agency, kind of like a hotline. Or for instance, Jody Murphy described it as, okay, if we know this youth has just disrupted somewhere else and is in a new placement and we're trying to stabilize him and make sure that things go smoothly at school so as not to further stress the foster parents, then we can give Jody a call and say, heads up, this is what's going on. And Jody will get in touch with the appropriate person at the school where the youth might be going. And so I know Erica was looking for someone for DSS to kind of be that person, just on an emergency basis, to perhaps staff a case or see if there are services that could be put in place to better support that temporary placement, or even some of the more permanent placements. So I think Katie has started to, she's gathering names and contact information for each person. And then regarding our provider survey, provider satisfaction survey, we are circulating that right now with some additional wording to help differentiate for the person doing the survey between the provider and the case manager. And so I know a newer version has been going around that we've looked at that I think clearly identifies that you're rating the provider, you're rating the services that provider is providing. And I don't know if we've finished looking at that yet or not, but we're trying to get that in so we can have the corrections made before, I can never remember her name, Tamara, maybe, before she leaves.
Yeah, so actually Mary's gonna help do that.
Okay.
Tamara has left, so I am doing that.
Thanks,
And I
Mary.
have the updates, correct? That's what you sent me, right, Jennifer? What needs to be updated? I just need to go in and do it.
I think so. I'll double check.
I haven't had a chance.
I can send it too. And we were trying to get that in place for April, because that's when our next quarter will start, and we're doing the data collection quarterly. So if that's possible, that would
That's
be great.
good. I need deadlines. As long as I have a deadline, I'm much better with a deadline. I can do that.
Yes.
Well, I will say I can do the English version. I'm not sure about the Spanish one because we have to figure that out, but I can definitely do the English one.
Awesome, thank you. And I think there was some discussion about, I know we have a non-mandated work group discussing our non-mandated funds and the use of those funds. We were also discussing putting together a CHINS work group to do some problem solving around CHINS cases. We kind of talked about whether we combine that with the non-mandated work group or we keep it separate. And I believe we decided to just keep it separate and to move forward with a separate CHINS work group. And I think agencies right now are in the process of deciding who they might want on that work group, or the program's representatives are going to start on that work group if we're not able to identify someone from the agency. And I think that's it for programs.
All right. Well, that brings us to the work plan under other business, and Misty has bravely agreed to continue facilitating that. She's a great CPMT chair partner.
Thank you. I just wanted to pick up and sort of summarize or reflect back what some of the things that were identified from last meeting, things that folks shared. You'll remember everyone sort of shared one thing that their agency was doing to engage in diversity, equity, and inclusion work and how that might be going, some effective things that they've tried or done as an agency. So a couple of the highlights. It seems like a lot of the organizations have a DEI dedicated position, or at least a DEI work group that sort of has a function within their department. We talked about engaging on social media differently with that in mind. We talked about a lot of agencies seem to be exploring what's the sort of required training for staff to have with regard to DEI work. What's the 101 level that is the baseline that as part of the onboarding, all staff will get this X training. Some folks talked about that they were doing some work related to DEI as they were doing job recruitment, including job postings, how to circulate those opportunities, how to interview, and sharing information around that. And then the last thing that we sort of talked about as a CPMT, what were we going to kind of take on next as far as that goes? I think not everybody had an opportunity to share what their agency is doing around DEI work, and there may be more things that folks can share in the spirit of sharing resources and leaning on one another for what's working, what's not working. So it could be, here's a really great exercise, activity, training that staff got a lot out of, or it could be, here are some things that weren't very helpful to our department and maybe shouldn't rise to the level of sort of vetted training or program, if that makes sense. So we can certainly continue with that. But I wanted to know if there was a sort of small project or a small action that this group could take on given our recent discussion. So that's where I'll open that back up to you all to start. What can be a small action, a small lift as a CPMT to engage in the DEI work as it relates to our internal team?
I'm not sure if this is small, but there makes some sense to me to start with our with a racial equity statement, a foundational statement that CPMT agrees upon, and where that statement lives, whether it's with our provider agreements, our contracts, et cetera. As sort of a step one, I think it helps to solidify commitment and understand where we are. So I just throw that out there as a possibility that can be really big too.
Can I get a show of hands of folks that have one, their agency has one that is like published? Is this sort of kind of from?
Yeah,
that?
I mean, we've got equity statements right now. You know, DOE is having trouble with educators and the word equity. But I mean, we've got equity supervisor. So we've got policies and statements about it.
Okay, about that position.
Yeah,
Okay.
we have one that is, it's called a commitment to cultural humility, but it's not published. It's just signed by each staff person. But
Okay.
I've been admiring the one that you developed, Misty.
What did you call that? A cultural
Commitment to cultural humility.
commitment to cultural humility. Okay. Does anybody else's agency have one, whether it's an internal statement or commitment statement, or whether it's published or not?
Krista, you can jump in if I'm wrong. I would say we don't, I mean, I think we've modeled that in terms of the work that your organization, Misty, helped us with, and then some of the Georgetown work. So I think we've been acting that out, but we don't have it, I don't think, in such a formal way. I mean, I think we're in a different spot in that we're a state agency, and that's sort of a big topic at this point. So, Chris, if you have anything to add, please jump in.
No, I think you're accurate.
Okay. So that's one project that we could do as a CPMT, whether that's its own subcommittee. We've had subcommittees before work on projects. I was thinking it could be even like starting off as a project pair. So rather than saying we have a formal subcommittee, maybe it's two of us in this group agree to take the first go at it by researching other statements and seeing what resonates with CPMT, what are other localities doing with that regard. So that's one option. What are some other thoughts that we could do as a CPMT?
And I think you could add to the provider agreements, the community practice model that was developed years ago. And I think it was updated, it's probably been 5 years ago, maybe 6. So it might be time to take a look at that again. And then the vision and values, and that, I think that got updated before I started working in the position. So I know that's been a little while too. So it might be worth looking at those things as well.
The multicultural additions that we made, that was for the provider agreements, correct? That went out, the CSA provider agreements?
So that's the community practice models where we incorporated those, and that part, we make that part of the provider agreement.
Got it, okay. One of the other things that I was thinking about is what would be CPMT's 101 training? Like what's something that we would all agree to do together as a group, as this group, and maybe debrief as a group? Whether, I don't know what that is, there's certainly a lot out there, but is there a webinar, training, a book, course, something that we could go together to do or read together or participate in individually, but all agree to do it?
So I can ask, I know OCS has created a work group, and I can ask them if they think they're going to have something coming out anytime soon in regards to that. I'm not sure, and it's a newly formed work group, so I don't know what their time frame is for trying to come out with materials, but it was my understanding that was part of what they were going to do, but I can ask them.
One of the things that our agency included in our anti-racist mission statement is that we included how we were going to do it. And one of the hows was that all staff would participate in X, Y, or Z training. So for example, if we come up with a DEI statement, we should be prepared to demonstrate like not only like how we will do that. So we'll do that as a CPMT by every CPMT member will agree to do beep to engage on this topic. So whether it's read this book, attend this training, do this exercise, you know, like some sort of thing to back it up. But I do think it would be, I'm speaking for my own self, I would like to engage in that work with this group because it's just a different group in which I've done that. And I think it has a lot of opportunity. Thoughts, comments about a shared training or experience? Any ideas about the benefits or challenges with that?
I think it's a great idea, like us agreeing to do the same training, even if it's online, so that we have something to talk about and reflect on. So I think it's a great idea. My mind goes blank because there's so many trainings and opportunities out there. So it's not like, you know, I have, let's do this. So I mean, Ashley, I know, is outside of her dentist office. And so I can understand if she's committed to make a quorum, but Ashley, you may be a really good resource from her because I know she brings that expertise around trainings as well. So that may be something that we just look of what's coming and what's available, and then we could sign on to see. But there's just so many training programs.
The other thing I was going to throw out there is just remembering that CPMT back in the day had retreats, and this might actually be a good retreat item to think about that we could do. Again, I don't think we've had one in a good while, and so that might be a place to try to do something like that as a group together.
We've had retreats, they've just been virtual, so it blends in with the rest of the meetings. But we have had, and I think in May is when we do it, but if we were going to do something, it would be great to maybe do that as part of our experience for the retreat, as part of the agenda of that. That'd be really, but we would want to plan it now if it's going to happen in May, because we only have one more meeting before then. What were you going to say, Martha?
Well, I think it's a great idea as a part of a retreat. And I mean, we may still be stuck in virtual, but I think it would be really great to have some of those conversations face to face. And this is certainly slanted to my world, but I don't know how many people have read Just Mercy by Brian Stevenson. And if you haven't, you should. And, you know, listen to his TED Talk. And I mean, he's an incredible speaker and has so much to share. So that would be one of my suggestions.
Can you say that again? The person, the name, the book, whatever.
The name is Brian Stevenson.
Okay.
And the book is Just Mercy.
That's a great suggestion, Martha. Thank you. Ashley just messaged me. She's having some tech issues, but she can clearly hear us. And she was saying that she's happy to help and that she's working on bringing a virtual version of the groundwater training. Have you all heard that? Or have you attended that training? That's a great 101 because it basically lines all of the intersectionality of all of the different arenas in which racism pervades everything. And it's irrefutable data. And it's just a great 101 especially for folks that are looking for more of that like data, that data drives their motivation. They need to see it, hear it, touch it, feel it sort of thing. So, so Ashley's working on bringing that virtual experience for free to the community. So we could all sort of commit to each other. We're all going to attend on this day to do this and maybe use some CPMT time to debrief that and what our reflections are.
I've heard great things about that training.
Yeah.
And just the way they conceptualize with data. irrefutable data. It's, yeah, that would be awesome. That's great.
What are you gonna say, Sue?
Just one of the, speaking of Just Mercy, one of the things that we did and fell off the wagon during COVID is we did book groups, and one of the books we read was Just Mercy, and it was facilitated by the librarians, and they were great. They did a great job of facilitating it around the specific topics raised by the book. It was helpful to have that done by someone outside of the organization.
I would
So
agree
who
with that.
facilitated it, Sue?
One of the librarians.
Oh,
We did a couple of different books, and it was a great experience for those folks who like to read books. Yeah.
Ashley also suggested that as well, some sort of book club model. I don't read books, but I can. And I would. Okay, well, does anybody have a leaning one way or the other as far as what maybe we should, if anybody wants to pair up or partner up to do either one, and it could be about both and, let's just put it that way. One topic could be, or one project could be to start looking into what a statement might be for this current CPMT. Another project would be to plan for something that we can do at our May retreat.
Well, I'm interested in working on a statement now. Doing some research on what's already out there.
Right.
So I can share Region 10's statement for that, as well as Arise's statement. And Arise is the DEI group of the Mental Health and Wellness Committee. And so it has a large membership, and that's a good one I've worked on as well.
Since there are some members of CPMT that left early or aren't here today, maybe we could send a follow-up email to CPMT identifying that Sue would like a partner or partners to look at the DEI statement for CPMT.
Nito, I was overhearing what you said, then you're not offering to partner with me. Okay. Yeah.
You mean? Because I don't have the time. I'm like so overwhelmed. I'm into it and would love to partner with you on it. And I'm working with myself not to volunteer anymore until I can dig myself out of a hole. So that's why I'll send things, because I am into it. I don't know that I have the time right now. I'm sorry.
Yeah. Send me whatever you have. I'll see what I can do.
Okay. Anybody really excited about planning some sort of shared experience training workshop DEI related for our retreat agenda?
So I would love to weigh in. I just don't feel like because of the vacancies and stuff here, I can take the lead, but I'd love to be supportive in some way, Misty. We're just struggling to get those supervisor spots filled and keep things running until that happens.
I get it. That makes sense.
Is there, I'm curious if there's somebody in the city who kind of their role is to help boards or employees with accessing these types of trainings, or somebody at the county even that might be able to help. I don't know the answer to that question.
Yeah, I think there's a couple of local opportunities for sure. A couple different facilitators that could come and join us that we've used in our department or have partnered with that we could explore. How about I put together maybe a menu of choices for the retreat, and we can peruse the menu. And you guys can advocate for which experience. I fully recognize that I just said one person suggested maybe it's in a retreat agenda item, and I'm like, yes, it is. That just happened. So I don't know if we're supposed to vote on that or if there's consensus. Is anyone opposed to having that on our retreat agenda item?
I think it's a great
pause.
idea.
Okay, again, I realize that not everyone's here, so maybe we could add that into a follow-up email. Is anyone opposed to engaging in a DEI-related exercise, activity, or training during our retreat in May? Okay. Okay. Thanks. We're getting there.
That's great.
And
So
who's gonna send these emails? Because I'm putting it in the action.
Misty.
Would you like me to? I just send it to you. I'll create it and send it to you and you can do the listserv, or do I just reply all to CPMT?
You just want to create it and send it to me and have me send it out to everybody? Is that what you said?
Yeah.
Yeah, that'll work.
And Ashley also said that she can help finding something for the retreat. And there's also a save the date for the virtual groundwater training. It's June 14th at 9 a.m.
And did I hear Ashley say that that would be available to the community?
That's
like outside
correct.
of this. There's a lot of people that want that training. So I'm kind of really excited about that. That's awesome.
So if you all can hear me now, hopefully maybe tech wants to play nicely with me.
Yes.
Awesome. I saw someone nod. Amazing. So that groundwater, the way that I plan on doing it is opening it up to city staff. You all would be included in that. And then the remaining seats to the community, because I want to make sure that individuals who are serving our community aren't unintentionally going out and doing harm just because they haven't had the opportunity to engage in a different way of thinking and considering race and race equity. However, I am always happy to have any feedback of things that you're hearing from the greater community that they may want to see, because if we determine perhaps that there is enough community interest to justify perhaps me seeing if I can reserve a time with REI for a weekend, because this one is during the day. And I'm more than happy to consider any of those things. So please do not be a stranger to my inbox. When I actually get to do it, this is part of my work, and it's the part of my work I love. I just don't get to do it as often as I want to right now.
Thanks, Ashley. That's awesome. So under our work plan, we also have onboarding members and brainstorming for recruitment for the city parent rep. Probably can't do both of those, or maybe we can, but which one? Is Katie on here? Okay. So since Katie, oh, you are here. You're just called Mary.
I'm here. I just turned my camera off because I'm having connection issues. It keeps freezing.
And it keeps telling us that you're Mary Stebbins.
Yeah, it says you're Mary Stebbins, but we'll call
I'm
you.
not. That's so strange.
Do you want to talk about and sort of start that brainstorming for the recruitment for a city parent rep?
Yeah, I would certainly love to at least introduce this again. I think we talked about this when maybe last spring when we were doing our retreat. And I think it's included on one of our goals in our strategic plan. You know, the city's been without a parent rep for a while. And Jennifer and I were talking, and we were thinking that, you know, since we're having to recruit for the private provider rep positions here soon, it might be a good opportunity to also try to do some recruitment for the parent representative position. And so, you know, in the past, we've talked about, reaching out to parent groups within our prospective agencies, and that kind of thing. And so just wanted to brainstorm some ideas about how we might be able to get the word out. Or even, take it back to your agencies and ask folks to think about parents that they've worked with in the past. It can't be a current family that we're working with, obviously. So, if they have any names or they still have contact with an old client or family that they worked with and they think that person might, do a great job serving in that position, that would be great as well. So just wanted to maybe brainstorm some ideas of how we can kind of get the word out about it. So if anybody has any great ideas, we'd love to hear them.
And when you say parent rep, you're talking about CPMT, correct? So the city CPMT. I just wanted to clarify that because there is a parent rep on FAPT and program, right? Okay.
Yeah, we have a parent rep on FAPT. The parent rep on CPMT also serves as the parent rep on program because program's a subcommittee of CPMT. So there would be 2 meetings a month. The other thing that we've talked about in the past and it never came to fruition was whether or not there's the ability to compensate our parent representatives, and how that might be really helpful. So, if we're able to go back and ask about that.
I did ask both the city attorney and the clerk, and I'm waiting on their response.
Okay,
So
great,
I did
thank you.
ask or send an email. I'm just waiting for them to let me know.
And Misty, it's Ashley. I definitely would lean on what the city attorney and the clerk says, but I know that it has come up to provide stipends in the PCOB, and the sort of pushback has been that then maybe council would need to provide stipends for any board or commission that may have an individual who would like to serve, who has, circumstances where that would help support their service. So I can't tell you in the city, I hope that she gives you a better answer than that one. But I can tell you, at least when it came up a few weeks ago, specifically about the PCOB, that was sort of the pushback, and they were going to pay for it out of their own, well, not their own, out of Hansel's budget. And even then it was, no, this would need to go through council, and they would probably have to think about all of the boards and commissions.
And that doesn't sound very optimistic. So what you're saying is they're not probably gonna, that's not something that they're interested in doing?
I don't think it's ever been brought up to them before council in a formal ask.
Okay.
I know that there were some committees where, because each council member has a line item, for example, Mayor Walker, I think, helped support some individuals who were serving on some of her committees. But it's never been a full organizational thing. As I've been telling everyone during the budget season, please feel free to join one of the budget sessions and make sure that our city council knows what we should be doing, because at this point, the budget is in their hands.
Okay.
I don't think it was a question about, I think like Hansel, we had an idea of where the money would come from. It was just about getting, is there any sort of policy that prohibits it? And sounds like there might not be a policy necessarily to prohibit it, but there's strong feelings that city council will need to be in agreement.
Well, that sounds like there's also not a policy to allow it.
That is correct. There is not a policy against it. There is not a policy that would allow it. And I think the concern, again, would be equity, because from my standpoint as the DEI person, every one of our boards and commissions, from tree commission to everywhere else, really could benefit from having different voices on. And usually those voices, we're asking them to miss their lunch break. We're asking them to, you know, maybe when we go back in person, especially to have to find childcare for their kids. And so I think that when I brought this up to the mayor, his perspective was not a hard no, but it was, how do we do it where everyone gets an opportunity to serve where they want, and we provide that support. So it was very much an equity mindset that gave him pause. Because let me tell you, if we could have a little more diversity on the tree commission, number one, they want it. And number two, I think it would be helpful, but they can't get anyone to serve. So I would say we can be in the middle of the bell curve of optimism. I wouldn't throw us all the way to the outlier of, yeah, it's going to happen immediately, but I definitely wouldn't put us to this is never going to happen. So we'll lovingly play in the middle of the curve.
Okay. All right. Okay, so that being said, are there ideas about maybe things we haven't tried before to get the word out? What do you guys think about going back to your agencies and asking if there's any family members that folks have worked with before that might be a good candidate? Or if we know of any parent groups, again, like I'm happy to reach out to people. I just don't know who those people might be if we wanted to try to get the word out.
The Charlottesville Special Ed Advisory Committee happens to be meeting at 5:30 this afternoon. I won't be able to be there because at 5 o'clock I start teaching a course for UVA, but I can send a message to the person who's conducting that meeting, and because that's parents, to see if there's a parent who might be interested. So I'll do that as soon as we get off. I'll send a text to that person.
Yeah, and you're welcome to give them my name and information if they want to know a little bit more about it.
Okay.
I'm happy to do that.
So we're needing somebody just for CPMT.
Well, for CPMT and program
And
for
program.
the city.
Program is 2 meetings a month and CPMT is 1.
No, they're both just one, the first
Okay.
and third Wednesdays.
So we want two different parents. We don't want the same parent. For
No,
the
it's we've used the same parent. So they're appointed by the board, by city council. And we've used the same parent because programs technically a subcommittee of CPMT. So if they're appointed to the CPMT, they would serve both.
Okay.
Finally, given the data that we got from Bob earlier, that 47% of CSA dollars are spent on special education. So it's a really compelling argument that the majority of the budget is spent on SPED programming and services. So that's a really great idea, Beth.
Are there any other parent groups that we know of? I think in the past we've reached out to foster parents, although, we're really looking for, ideally, folks that have had firsthand experience.
Maybe, what about reaching out to Mary Coleman, who runs the City of Promise, to see if she has some parents that, are wanting leadership and impact sort of opportunities.
That's a great idea. What's her name? Mary Coleman?
Mm-hmm. Yeah, she's the director of City of Promise.
Okay.
Just thinking that out loud too, what about reaching out to city housing and their peer folks that Todd Niemeyer supervises? I don't know these people's position, but Todd Niemeyer, Misty, and his group, like they may be in contact just as working in the communities, Charlottesville communities, city housing.
Well, Todd is now the head at the Office of Human Rights for the city.
His old position.
Are you talking about when he was doing the community garden?
No. Okay, so this is my lack of knowledge of the city structure. So the what I'm talking about is the resident housing, the housing peers. I guess Mayor Walker created the group of housing.
I wonder if.
Okay, I know where you're at.
Far.
You're talking about Home
Thank
to
you,
Hope,
Ashley.
and yeah, and Home to Hope actually, despite the
Yes.
name, doesn't do housing. They support individuals who are exiting incarceration and rejoining our community.
That's the CBRHA group, is that, or?
I think you're thinking of FAR, public.
Yeah,
housing.
FAR is and they're not a city group. They're their own thing. They're their own 501c3.
Right, I know what FAR is. Okay.
That's a good place to do some inreach though, I think, sure.
Yeah, that would be a good.
Does anybody have a contact for FAR? I mean, I can certainly just try to find it.
Sure, Katie, I'm sending it to you now.
Thank you.
Yes. What is that? How's that? FAR, FARR?
PAR.
Public Housing Association of Residents.
Okay.
And they also have a website if anyone just wants to know more about what they're doing.
All right.
Okay. It's a good place to start.
I've sent my text, so I'll let you know after today if we get any takers.
Okay, thank you.
Sure.
And the last item on our work plan that we'd hope to have a conversation about, looks like we have a little time, is the onboarding. It's the onboarding members, the CPMT members. I saw an email with the acronym list update. Yeah. Is that you, Jennifer?
Yeah, we'd started looking at the acronyms list, and I've got now, I think, 2 or 3 different acronyms list. And so they look all different. Some of them are just the actual acronym and what they stand for. Some of them are the acronym, what they stand for and what they are. And so what I thought would be helpful is to see if, and I know everybody's busy, but if anybody would have time to help work on what would actually be helpful for you guys. You know, Katie and I tend to know what a lot of these stand for, and some of you may as well. So I'm just wondering, like, what's the most helpful way to put a list like that together? Or, you know, if you don't have time to meet, even just time to review the ones that we have to pick from, or just find a place to start, because we want it to be helpful for folks.
I would be
so
curious.
Go ahead.
About our existing, is there any, we have one Albemarle County parent rep who's on program. What about FAPT? Are there parent reps on FAPT?
It's the same parent rep for the city and the county on FAPT.
Okay, and they've been at it for a while, right? They're pretty familiar, probably. Yeah, okay, never mind. I was gonna say that would be an opportunity to have them review it or a provider to review it, because it may just have a different perspective or a different lens if it's not the sort of acronyms that some of us like talking all the time. Because and it could be someone that depending on what the acronyms are, but in order to be effective at CPMT or be able to like understand the language of it and the acronym language, I mean, is to have someone review it that hasn't had the similar kind of exposure to it. So I wonder if like Ryan Davidson maybe is somebody, since he's new to CPMT, can he look at it and identify the ones that seem familiar to him or not? And that could be sort of a litmus test as to how, like, what would be helpful to somebody that's new to the team.
That's a good suggestion.
Just give homework to Ryan Davidson. And he's not here. This is awesome.
That's why he gets homework. Okay.
Yep, we'll start there. Thank you.
All right. Well, we've made it through our agenda. Thank you, Misty, for meaningful work on a work plan, making our work plan meaningful. It's awesome.
You're welcome. Thank you.
Is there any agency updates? All right, then let's adjourn.
Bye, everybody.
Bye,
Bye.
everyone.